Diagnosis according to 6 stages, the Jueyin stage. This is the deepest level that pathogenic qi can reach. It is very critical when pathogenic qi has reached this stage. There is an extreme Cheng qi deficiency, and the regulation of yin and yang has become chaotic. At this point, yin and yang can start to separate. This will often manifest with symptoms of extreme heat or cold, or a violent alternation between the two. There will often be a symptom of heat and cold simultaneously. The heat can, for example, manifest in the upper part of the body and the cold in the lower part. There may be extreme heat symptoms in the torso, but extreme cold symptoms in the extremities. The heat will injure the fluids. There can be a strong thirst, and the person's skin and flesh can be wizened. Ascending yang will manifest with a sensation of heat, turmoil, and pain in the chest. The presence of heat and cold simultaneously can manifest with a gnawing hunger, but no desire to eat. There may be vomiting and diarrhea. A more harmless variant of this pattern is observed when there are intestinal worms. Exogenous pathogenic qi that has penetrated into the body's deepest level and fundamentally damaged in our young. Ingestion of contaminated food. Symptoms and signs: restlessness and turmoil in the chest, extreme thirst, pain and burning sensation in the cardiac region, hunger with no desire to eat, cold limbs, diarrhea, vomiting of worms, wiry pulse. Key symptoms: restlessness and heat in the cardiac region, cold limbs, hunger with no desire to eat, persistent thirst. Treatment principle: drain heat from above and cold from below, harmonize yin and yang. We can choose from the following acupuncture points: stomach 36, REN 12, liver 3, P6, and 220. We tonify stomach 36 and REN 12, even technique on liver 3 and pericardium 6, and drain 220. Liver 3 harmonizes liver channel, pericardium 6 harmonizes pericardium, stomach 36 and REN 12 harmonizes stomach, 220 lowers rebellious yang qi. Relevant advice: this will depend on how much heat and cold is present. It is important that the patient gets adequate rest and does not overexert themselves. If there are worms, the person should take medication that kills the worms and avoid further contact with sources of infection. The Triyin pattern can be caused by Taiyin stage and Shaoyin stage, and it can result in Taiyin stage and Shaoyin stage as well. Thank you for listening.